My name's Caroline. I'm the first primary care network dietitian within Bolton. I started my post earlier this year in March, so it's been just over 5 months. So with regards to dietitians working within primary care, it is quite a relatively new role. It's a new concept, it is quite exciting. So I'm not yet trained as a first contact practitioner, but I am hoping to soon be allocated a position on the course in order for me to develop into this role. So I currently see patients within the Charlie Road PCN, so this covers 5 different surgeries. So as part of my role, I complete nutrition and dietetic assessments for a variety of different patients, adult patients. My referrals come primarily through other sort of professionals. Some of these patients include weight management, IBS, nutrition and support, those that are referred for that advice. So I do work closely with other clinicians within the MDT, and I do link in with the community dietitians where needed to ensure that there is sort of a streamlined service. So my previous role was actually working as a community dietitian within Bolton. So this actually involved home visits, clinics, some ward work, and also nursing home reviews. So this has really allowed me to gain the knowledge and the experience in order to progress into this role. At the moment, I currently don't have a named allocated supervisor, but this is something that I will need to obtain once I start my first contact practitioner training. So at the moment, any queries that I do have, I liaise with any of the other professionals within the practice. So this could be a GP, the advanced practitioners, reception staff, also the community dietitians. So if this is a dietetic related query, I've got quite good relationships with them that I can speak to them to get their advice. So as part of my role within my previous post, I was actually a named supervisor for the student dietitians and newly qualified dietitians, and the assistants. So I would set clear meetings to ensure that they were supported, and this was provided regularly, usually on a weekly basis. So I've found working within primary care, it's allowed me to gain access a lot quicker to a wide variety of different professionals, such as GPs, nurses, advanced practitioners, other first contact practitioners within different roles. And this has allowed me to gain, first of all, an understanding on their roles and the need within primary care. But also just helps me to know where, especially covering 5 different surgeries, who I can access. So an example of what's worked well, I'd probably say I did have a patient come to me who her first language wasn't English. She did require an interpreter, and she'd had gastric sleeve surgery abroad. So with that, there was no documentation of this procedure, but she'd not had any of the follow-up that you would get if you'd had the procedure done in the UK. So I did need to speak to one of the GPs that day, just with regards to making sure that she had her bloods done and the actual medication that's needed, the supplementation and ongoing care was dealt with and followed up. So that was something that was quite challenging, particularly with the language barrier, in addition to not having the documentation. But with regards to having somebody there to actually discuss this with, that we were able to overcome that and make sure things were done and moving forward, the right process to be done. As someone new coming in, actually learning the different systems, also learning how each GP practice works was probably one of the biggest challenges that I have faced. And also having access to a GP is different within each of the practices. So I would say that's probably something that I have found more challenging than anything, but hopefully the more experience and the more I get into each of the surgeries, and the longer I'm there, I'll be able to develop that. Anyone that wants to be a supervisor does have an open door policy. So just allowing professionals to have a clear contact to ask questions to on a day-to-day basis, and also being approachable and friendly. I think that's really key. From being a supervisor in my previous position, to junior dietitians and assistants and students, setting time each week to actually allow them to discuss anything, bring things to them, to you, just so that they felt supported, I think is really important. So I do believe that those that feel that they are supported and they've got somebody to discuss any queries with, as little as it may be, you know, no question is a silly question. It does help with sort of their development, but also job satisfaction and productivity overall.